Welcome. My name is Brad Faltzgraf. I'm a clinical instructor at the University of Kansas Medical Center in the Clinical Lab Sciences program. And so today we're going to talk a little bit about what clinical lab science is because it's a health profession that's often behind the scenes, but very important to healthcare. And so we like to call CLS CSI for the living because we're doing a lot of things you may see on a show like CSI and things like that. But we do it in a more clinical sense. And so medical laboratory science, or abbreviated MLS, is very similar to clinical lab science. They're interchangeable terms, but they play a critical role in healthcare by analyzing blood, body fluids, and other things that help provide a diagnosis to the healthcare provider. There is a piece of literature out there that says that about 70% of medical decisions in a hospital setting are based off a laboratory result, but you wouldn't know that unless you know a little bit more about clinical lab science. And so I made this chart here to kind of show you what you may think of when you think of healthcare, especially from TV shows and news and media. Is in the green boxes is what you see as healthcare. A patient comes in and they're assessed, then they're given a diagnosis, and there's a decision making for the treatment, right? But really behind the scenes, there's very crucial steps that clinical lab science plays a part in, like collection of specimen, whether that's blood or body fluids or whatever it may be, laboratory analysis of those, communication to the healthcare provider, then a diagnosis can be made. Somebody doesn't just walk in and immediately get assessed and diagnosed to a disease without some sort of evidence behind that diagnosis, and that's where we come in. So clinical lab science is kind of an umbrella term for multiple different specialties in the laboratory, and our program provides our learners with expertise in each one of these areas. And so what I'm going to do is dive in a little bit more about each area in the subsequent slides. First of all, we'll talk about hematology, which is the study of blood and blood-forming organs. And so things like red blood cells, white blood cells, platelets, coagulation, which is the clotting of blood, or you may know it as forming a scab when you get cut or something like that, and bone marrow. And so a lot of people don't know that all of your cells in your body that are involved in blood, like red blood cells, white cells, and platelets, are created in your bone marrow. That's where they grow up. They're born there and they grow up. If you do a quick feel on the back of your hip, right at your hip bone on the back, you can feel two sharp points. That's known as your iliac crest, and that's where the most active site of bone marrow generation of blood cells is right now in your body as an adult. And so if you were to have a bone marrow collection, that's where it'd be collected from. And hematology, they can help diagnose cancers like leukemia, bleeding disorders, sickle cell disease, things like that. And so here's an example of what it looks like if you take a drop of blood, put it on a glass slide, and smear that blood over the glass slide into a thin layer. And then you look at it under a microscope. This is what it looks like. The red arrow here is pointing to a red blood cell. That's what a red blood cell looks like on a microscope. It's nice and round. It kind of looks like a concave disc. Here, the blue arrow, this is one type of white cell called a lymphocyte. It's one of many kinds of white cells. And then this black arrow here points to platelets. And what platelets do is anytime you get let's say a cut on your skin, the platelets recognize that and rush to the site and kind of like link arms and form a scab or a clot. On the right here is somebody's blood smeared out on a glass slide, and you can appreciate that it looks notably different than the slide on the left. And so this slide here shows somebody with sickle cell anemia. So what happens is their perfectly round red cells, due to a genetic disease, can't really hold their structure when they're in an environment with low oxygen. So they sickle. And that's a problem for multiple reasons. First of all, it's painful for the patient because these red cells can't get through the small little capillaries and they get stuck there and it's painful. Secondly, the job of the red cells is to carry oxygen throughout the body, and these sickle cell red cells do not carry oxygen like they should. And so it's a detrimental thing to the patient. And that's only diagnosed by hematology. This is a same thing except with bone marrow, not blood. You take a piece of bone marrow and you put it on a glass slide and smear it out. This is what it looks like. This is where all your baby cells grow up. This is a bone marrow also of a patient, but you can again appreciate the difference between the two. On the left, there are all kinds of different cells and they're happy and growing up. On the right, these cells to me just look angry. They just look mean. They're bullies, right? They take over, they're over proliferating, and they don't let anybody else grow up. And this is somebody with acute leukemia. Leukemia being a cancer of the blood, it actually is a cancer having to do with the generation of white cells. And so this is not good. This would be somebody with acute leukemia. And again, it's only diagnosed by hematology. Next area of the lab we're going to talk about is chemistry. And so you may think of chemistry as periodic table, right? Or radioactivity or stuff like that. That's fundamental chemistry that is not the same as clinical chemistry. And so clinical chemistry is defined as, testing plasma or serum for different analytes. Okay, when analyte, what I mean by that is things like glucose and sodium and potassium and hormones and vitamins and other things that, if they're not present in certain levels in your blood, can lead to disease. Glucose is one you may know of. This would be the area of the lab where they measure glucose in people's blood. Well, variations in glucose measurements can lead to diagnosis in diabetes. And so that's probably something you're familiar with. Somebody with diabetes has a really, really high glucose. A patient walks into the hospital for a doctor's appointment. The doctor can't look at them and say, you're a diabetic, right? If they have no known history, they have to collect a blood sample, send it to the lab. The lab measures the glucose. The glucose comes back really, really high. The lab will call the healthcare provider and say, hey, their glucose is really, really high. The doctor says, hey, to the patient, hey, you have diabetes, right? And so there's those hidden steps that I mentioned earlier that are behind the scenes, but are critical to the diagnosis in this case. Clinical chemistry is a fairly automated area of the lab. They have large analyzers and instruments that help them perform all the tests on the samples. This is a picture of one of the analyzers at the University of Kansas Hospital that does all the clinical chemistry testing. Urinalysis is also included in clinical chemistry, and so you can actually get a lot of medical information from somebody's urine. It is a great indicator for kidney function, right? Because urine passes through the kidneys and is regulated by the kidneys. And so if somebody has an abnormal urinalysis result, you can start to investigate their kidney function. You can also get an indication for a urinary tract infection, and that's just a bacterial infection in your urinary tract. So I've included a picture at the bottom here of what a normal urine should look like, as far as you can hold it up to a piece of paper and read through it. That's something called lack of turbidity. As you start to get more and more turbid, you see the urine becomes more cloudy and more cloudy. That is an indicator that there's a bunch of things in that urine, whether it's bacteria or cells or whatever it may be. It's not a good thing to have, obviously. Also, when you look at urine under a microscope, you can actually observe the presence of crystals. And so this is something here called a calcium oxalate crystal. It doesn't point to any particular disease diagnosis or anything. It's usually just due to a pH imbalance. Same here. This is something called a triple phosphate crystal, and it's very nice to look at under a microscope. It kind of looks like a coffin. But again, it doesn't really point to anything disease diagnosis wise. And on the bottom right here, this is actually a picture of yeast. And so people have yeast infections. They'll have yeast in their urine, and it's just a little, what we call a yeast bud. And when it's a budding yeast, it's growing other yeast in a chain-like structure. Okay, and so that would point to somebody having a yeast infection. Next area of the lab we'll talk about is microbiology. And so a lot of you, I'm sure, have done some sort of microbiology in one of your science classes. The most common experiment I hear is swabbing your desk or swabbing your cell phone or something like that, growing it on a petri dish or an agar plate or whatever the terminology you use may be, and seeing what grows on it, right? And it's actually astonishing to see how much bacteria is on everyday surfaces. But that's more of a fun kind of experiment. Clinical microbiology is focused on using specimens from patients to point to a particular bacterial infection. Okay, so let me give you an example. Let's say somebody has a really large cut on their arm, and not just a superficial cut, like a deep cut in their arm. Well, they're going to be disinfecting the cut, wrapping the cut, and trying to let it heal. But over time, when they have to change the dressing or something like that, those cuts become infected and stuff like that. So they might take a swab and swab that infection point, grow it out on a plate, and see what kind of bacteria grows. Because the different types of bacteria that you identify lead to different treatment regimens. One bacteria may need one drug, one bacteria may need another drug. And so it's important to know what bacteria is infecting this wound in this case. And so they grow it overnight on multiple plates. This is just a picture of one, and it kind of looks like this. This is bacterial growth. This lady here has multiple different plates. And what, long story short, these plates do is allow certain bacteria to grow on one plate and not another, and you can kind of use them to differentiate the species of bacteria. So once they identify the species of bacteria, microbiology, they like to test what drug works the best for that particular bacteria. Okay, so you can see on this plate here, fuzzy areas of this plate, this is it's bacterial growth. So they grow bacteria on the entirety of this plate. Okay, then they put these little discs on the plate and let it incubate overnight. Well, what each one of these discs are is a different antibiotic. Okay, so it could be vancomycin and streptomycin and tobramycin and any of these other drugs. They're all different. Okay, so what you're seeing here is this zone of clearing of the bacteria means that this drug killed the bacteria. It was effective in killing and inhibiting the growth of the bacteria. Where you can see, like, for instance, this disc here had no effect on the bacteria. The bacteria grew all the way up to the disc with no zone of clearing. So when we see this in microbiology, we would call the doctor after, it incubates overnight. We'd say, hey, this patient has a Staphylococcus aureus infection, and use tobramycin, not streptomycin. All right. And then that's the way the doctor knows what drug to use to treat the infection. Okay. So you can see that's a long, drawn out process, but this is the clinical lab is critical to the treatment of these kinds of things. The healthcare providers can't just look at an infected wound and say, I'm going to throw it this drug or I'm going to throw it this drug, right? You got to really know for sure. And so this is one of the coolest areas of the lab for sure. And just a fun fact, did you know that the average cell phone contains about 18 times more bacteria than a public restroom? All right, so next time you are near hand sanitizer, go ahead and put some on your phone. The next area of the lab is the blood bank, aka immunohematology or transfusion service. Okay, so this is where I typically ask the students, has anybody ever donated blood before? And you may or may not know your blood type, but typically they tell you your blood type after you donate blood. All right, so you may be familiar with the 4 different major blood types that there are, but they're really it's much more complicated than that. And so we'll talk about this chart just a little bit. The major blood types that you probably know are A, B, AB, and O. Okay, so just for visual purposes, somebody that's type A, every single one of their red cells, remember that picture of the red cells we saw back in the hematology section of this presentation? Every single one of those has a ton of, this is microscopic, you cannot see this with the naked eye, tons of what's called A antigen sticking off of every single one of the red cells, okay? But for our purposes, purple dots little circles hanging off all their red cells. A person that's type B doesn't have purple dots on all the red cells. They have, again, for our purpose, green squares. It's something called B antigen. We're going to go with green squares. Somebody that's type AB has both the purple circles and the green squares. Somebody that's type O has neither one of those. Okay, so why does that matter? It's key because somebody that's type A has something called an antibody circulating in their plasma. All right, and they actually have an antibody. And if you don't know what an antibody is, think about it as a weapon. It's a weapon for your immune system to attack. Okay, so somebody that's type A actually has a weapon called anti-B, where it's anti-B. If it sees that green square, it's going to attack it, and your immune system is going to clear it. And so that's not good, right? Somebody that's type B has anti-A. They have again, weapon against purple circles. Okay, somebody that's type AB has neither one of those antibodies, and somebody that's type O has both. Okay, so where that comes into play is, let's say somebody is a type A person and they get transfused with type B blood. What happens is you start infusing that type B blood, and their anti-B antibody will attack those cells, and they something called lyse the cells, and it's typically fatal for the person that's receiving the transfusion, which is obviously terrible. And so some of you probably heard that if you're type O, you're a universal donor, right? And this is the reason why, because they don't have A or B antigens on its surface. So no matter what weapon you have against antigens, you're not going to attack O-type cells. So if you're one of those people watching this and you're a type O, go donate blood. People that might need a transfusion include the obvious that you might think of, somebody that's involved in a trauma accident, a car crash, something like that, where they're losing a lot of blood and they need transfusion. But there are actually other clinical scenarios where people need regular transfusions, and that would some of them include people with leukemia, people on chemotherapy, people with sickle cell anemia receive frequent exchange transfusions. So it's not just in trauma scenarios. The most up and coming area of the lab is called molecular diagnostics. And basically, people like to say it's the future of laboratory testing. And so basically it's DNA analysis. And there's many, many ways you can analyze nucleic acids, or DNA, RNA, nucleic acids. Okay, so I'm going to provide a couple of examples on this slide that you may be able to understand. And so on the left here, this chart here, this would be your classic paternity testing, right? That you may see on TV shows or something like that, where they can take a mother's DNA and a child's DNA, and then they take an unknown father, right? Is this the father of the child or is it not? What you can do is compare their DNA profiles to prove that this person is the father. So this child in this particular situation has 6 and a 7, we'll call it. Well, they got the 6 from the mom, and they can prove that they got the 7 from the dad. Now, to do paternity testing, you actually have about 13 to 16 different of these markers, but I only included one for today's presentation. On the right here, this is somebody loading an agarose gel before they perform electrophoresis. Another really good example of molecular diagnostics applies to the current situation we're in today with COVID-19, right? You hear all the things on the news: COVID testing, COVID testing, COVID testing, right? You've probably heard it a million times. And I don't know if you've ever asked yourself, who does the COVID testing? Is it the doctor? Is it the nurse? The answer is neither. It's the clinical lab, right? And so whether the doctors and the nurse may collect the specimen, usually it's a nasal swab, and then they send it to the lab. And so this is where we come into play. The most popular type of COVID test is a molecular diagnostic test called real-time PCR. And so what they can do is take a patient blood sample that contains COVID DNA. Actually, it's RNA. Edit that out. And what they can do is take a probe that is complementary to the nucleic acid of the virus, and they can mix it with the patient blood specimen. Okay. If the probe that is complementary to the viral nucleic acid sees viral nucleic acid, and that's this red strand here, it's going to bind. And this probe is designed that when it binds, it flashes light. So we know that when we mix a probe with patient blood specimen and light comes out of the reaction, that sample is positive for COVID, right? If we put that probe in and we mix it with our patient specimen and we get no light production, that means they're negative, right? And so that's kind of a super far out overview of how COVID testing is working. But it's definitely something that, again, doesn't get the credit it deserves in the clinical lab. So it's very cool. That is only 2 applications of molecular diagnostics. It's rapidly evolving, and we look forward to being a part of the future there. Okay, so we've talked about each area of the lab that is included under the umbrella of clinical lab science. So let's talk about how do you actually get into the field of clinical lab science. They don't just hire anybody to work in a clinical lab, because it's a very, like nurses, like doctors, you want people to prove that they know what they're doing by certification exams and board certification and that kind of thing. And so if you're one of those people that's strong in biology and chemistry and math, maybe clinical lab science is good for you. And so to be able to work in a clinical lab, you need to have graduate with a bachelor, minimum of bachelor's through an accredited CLS program, which here at KU we are. After you graduate, you sit for a certification exam. And the certification exam is a comprehensive exam of everything you've learned during school. And if you pass, you get the credentials on your name that says, I'm a certified clinical lab scientist and can work in one of these labs. It's a highly demanded degree. The job hire rate is 100% for our program, which we'll talk about here in a second. Starting salaries vary depending where you are in the country, but on average here in the Midwest, starting salary, fresh out of school, 4-year degree, start at about $53,000 per year, which sounds pretty good if you're a high schooler out there watching this. And they pay more for evening and night shift, right? You got to pay people more to work the night shift. Clinical labs are 24/7 labs. This is not just an 8-hour-a-day lab. So that means we need evening shift, we need night shift. And so typical night shift workers, when they start, you could probably add $10,000 to $12,000 per year onto their starting salary. So about $65,000, I would say, as a starting salary. That's pretty good. Again, for a 4-year degree. And this field in clinical lab science, although it's highly automated, is only expanding by about 22% projected over the last decade. The job market is, again, if you graduate from our program, is 100% job placement. So think about that. There are a lot of people I know, and a lot of your friends, when you go to college, will be saying, you know, I graduated college and now I don't know where I'm going to work. I don't know what I'm going to do. From our program, you graduate and you 100% of the time have a job, which is very rare for all fields of study. Again, we're highly in demand of clinical lab scientists. And most of our graduates have formal job offers before they graduate. So that's your selling point to your parents when you tell them you're interested in clinical lab scientists. And so basically, our students right now, we have a cohort of students that graduates in December. And this current recording is in September. And most of them, I would think about 60% of them, 3 months before they finish, already have a job lined up for them. And so it's pretty amazing. The structure of our program, again, I mentioned it's a 4-year Bachelor of Science degree, but our program here at the KU Medical Center is only 2 years. You have to do 2 years of prep work before you get to us. And you got to, these are all prerequisites, mostly science and math courses. So biology, chemistry, organic chemistry, algebra. And we like to say we require a minimum of a 2.7 GPA. And then you come to us on the KU Med Center campus in Kansas City for 2 years. And then you are completed with the degree. The first year here on campus, it's all science heavy classes, immunology, hematology. All of our classes have a lecture component and a lab component, right? So you go to the lecture and you learn all about the science behind the method, and then you go to the lab and practice that method to reinforce what you learned, right? So there's no meaningless lectures or anything like that here. Everything directly translates to your performance in the lab. The second year is the same thing. The key here in the second year is that our students, the last half of their senior year, they have something we call a clinical rotation. You may have heard doctors have to go through a residency, something like that. They're very similar. But the clinical rotations, basically our students go out to hospital labs or other reference labs or whatever it may be, and they work side by side with the certified clinical lab scientists, almost like they're working there, and they're training you on the job to reinforce everything you've learned in the first year and a half. And this is where most of our students get formal job offers way ahead of time because they're doing their clinical rotation in the lab. The lab likes a particular person for their skills in the lab and their knowledge, and they offer them a job way before they finish there. It's really a nice thing. This is a couple pictures of the clinical rotations. The picture on the left here, this is Lori. She has been at the KU Med Center for about 20 years, and she's performing a task, while Mackenzie is over here taking notes and watching. I should have had another picture about an hour later because it was Mackenzie doing the task with Lori watching. Again, it's valuable on-the-job training when you're still a student, right? But you're doing exactly what they're doing under their supervision. And so it's an invaluable experience for you as a professional. The certification that you get, I mentioned you sit for a board exam when you finish with our program, and you take a board certification exam in medical laboratory scientist, and you get these initials here, MLS, ASCP, after your name. There is certification for molecular biology, which if you're interested in the program, we can talk about that if you contact me or reach out, or you can do both. And that's, again, our program has options to do either one or both. So up to this point, I really only mentioned that our students and our graduates work at hospital laboratories, but really there's multiple avenues for our graduates to work. We've had students go into vet medicine. We have students that go into consulting. We have students that go into IT, right? Because all these laboratories run on information technology, complex computer systems and algorithms. And it's helpful, the people that work on those computer technologies, it's helpful if they have a background in laboratory. So if you're one of those people that is interested in clinical lab science, but also interested in IT, that could be a potential career for you. We have students that work in forensic laboratories, reference laboratories like Quest and LabCorp. We have students that go on to medical school, which I'm going to talk about in the next slide. We have students that go into research. There's all kinds of avenues that this degree can open up for you. It's not narrow path straight to a hospital lab if that's not for you. And so I mentioned we have students that go into medical school afterwards. And so they really like our students because our students have a strong foundation in not only healthcare, but disease diagnosis, algorithms, laboratory testing, other key parts of the healthcare all together, the scheme of healthcare. And so they love to have our students apply to medical school because they have a really a heads up on all their other students when they get into medical school. As far as scholarship opportunities, our department offers specific scholarships that we give out to our senior students during their senior year. We give very generous scholarships for students who graduated from Kansas high schools. And so if you're out there watching this and you're from a Kansas high school, that's all the more motivator to come to our program. There's also your normal scholarships, maybe through the dean's office for high GPAs and that kind of thing. And there's also scholarships through professional organizations. This is jumping ahead a little bit, but I have to plug our other programs that we have within our department. We have a Master's of Science in Molecular Biotechnology. We also have a doctorate in clinical lab scientists. It did start in the fall of 2019, and that is actually a different role. So if you're interested in that, you do have to go through a clinical lab science program first, have a couple years of experience before you consider a doctorate in clinical lab science. And finally, if you have any questions, this is a short presentation to pack in a lot of information. So if you're interested at all, it's never too early, no matter where you are at in your educational career, to reach out and contact one of us. Again, my name is Brad Faltzgraf, but our main advisor is Leticia Nunez, and her email is also included here. So if you have any questions after watching this, if you're interested or anything like that, don't hesitate to reach out and contact us, and we'd be glad to talk to you some more about it. So thanks for watching, and good luck in the rest of your career.